when should flow cytometry be considered? I think that given the information that I have provided to you, that when you establish the diagnosis for the first time on someone who has MF, and knowing that many of these early stage patients might potentially have blood disease, it's important to do a baseline flow cytometry at diagnosis and when you're trying to establish a staging. It's important also to monitor the disease during the course of the treatment. And of course, if you're gonna guide treatment, right? We have a patient with progressing erythroderma. You wanted to know if this patient has significant blood involvement, et cetera. Of course, we're going to be looking at follow-up data too when there is a change during the course of the treatment. If there are new flags that emerge during the course of the treatment. And of course, you want to monitor the disease after you've been adequately treating the patient with either systemic treatment or some other form of treatment that you're using. So, of course, when there are clinical flags that appear, these clinical flags might indicate disease progression, pruritus, the presence of lymph node disease, the presence of progression in the type of lesions that the patients have, if the patient now has more skin lesions, or if the patient now has plaques, tumors, or erythroderma, if the patient now has a high LDH, and of course the patient is not responding to treatment.